Hello friends, I am Reet Mukherjee, final year MBBS student at RGK Medical College and Hospital, Kolkata. So, I also watched this web series called Railwaymen, and which is one of the best web series in 2023. And today I am going to talk about the most highlighted part of this web series, which is MIC or methyl isocyanate. So, methyl isocyanate is a intermediate chemical in production of carbamate pesticides. So, as an extremely toxic and irritating compound, it's a very dangerous for human health, and it is the principal toxicant involves the infamous Bhopal Gas Disaster, which officially killed around 20,000 people. So, the methyl isocyanate is a colorless, poisonous, lacrimating, means tearing and flammable liquid which reacts with water and produce huge amount of heat. And in case of Bhopal Gas Disaster, this water and MIC reaction causes the main disaster. So let's talk about the toxic effects of MIC. Methyl isocyanate is irritating and corrosive to eyes, respiratory tract, means breathing tract, and the skin. The exposure symptoms include coughing, chest pain, dyspnea, asthma, irritation to your eyes, nose, throats, and as well as skin. Acute exposure of high vapor concentration over 21 ppm may cause severe pulmonary edema, injury to alveolar wall of the lung, emphysema, hemorrhage, bronchial pneumonia, and severe corneal damage, and even death. So the main mechanism of toxicity of MIC is actually alkalization of biomolecules. So let's talk about the effects on human health. So firstly, talk about the lungs and respiratory tract effect. So the symptoms include cough, chest pain, dyspnea, coma, and even death. The irritative respiratory symptoms such as pulmonary edema, bronchial spasm may occur in immediate response to the exposure. The methyl isocyanate induced pulmonary edema may progress to the effect such as alveolar wall destruction, bronchial pneumonia, which may ultimately lead to respiratory failure and even death. Child may be more vulnerable to this corrosive agent than the adult because of the smaller diameter of their airways. So let's talk about the effects on eye. Symptoms may include immediate eye pain, lacrimation means tearing, photophobia means intolerance to the light, profuse lid edema, and corneal ulceration. The ocular exposure may result long-term and permanent eye damage. Now let's talk about the effects on skin. Methyl isocyanate is a skin irritant, and it may cause chemical burn upon the skin contact at high concentration level. Now let's talk about the effects on gut. Nausea, vomiting, abdominal pain, defecation are reported after acute exposure of methyl isocyanate. So now talk about long-term exposures. So long-term exposures of methyl isocyanate may result in COPD or chronic obstructive pulmonary disorder. Let's talk about the chances of cancer. So till now, methyl isocyanate has not been classified for carcinogenicity. That means there is no chances of cancer due to methyl isocyanate. Lastly, reproductive and developmental effects. So methyl isocyanate is not included in the list of reproductive and developmental toxicant, but the increases rate of spontaneous abortion and neonatal death among the victims of Bhopal accident was observed for months following the exposure. However, the precise role of methyl isocyanate in developmental toxicity is difficult to determine, so that we cannot say properly that the problem seen in the victims of the Bhopal accident is only due to MIC. If you like my effort about this video, please share it to your friends and families so that they also can be benefited. Thank you.